Hello, my name is Julianne Ramirez and my infomercial is on methamphetamine. What is it? As you can see in that picture there with the crystals, that is a picture of the most common version of methamphetamine. And right below it is the chemical version and the chemical compounds of methamphetamine. So it is a Schedule II stimulant. Now what does that mean? The DEA categorizes drugs by schedules. A Schedule II drug specifically has high potential for abuse, can lead to psychological or physical dependence, which we will discuss later on. And it's a stimulant. It has a direct effect on the nervous system. In the case of meth, it functions with the part that releases dopamine in the brain, and we will get onto that later. It can be used to treat ADHD patients, and it has a crystal-like appearance. That is the most common form, and it's referred to as crystal meth, which is the illegal version of the prescription drug. The illegal form is cooked in a meth lab with over-the-counter drugs. There are different types of meth. Some of the most common street names include ice, speed, base, meth, and chalk. Ice is pictured in that first picture there where it looks like ice or broken glass. Speed is the powdered version, and base is that yellow version at the very end. Crystal meth is the most common form, and people use it in different ways, and we will discuss that in a sec. It is smoked with a meth pipe, snorted, and if it's snorted, it tends to be in the powdered version, known as speed, or injected, and if it's injected, that's the most effective or powerful because it goes directly into the bloodstream, and it just directly functions, takes it right to the brain. As more is used, higher doses will be needed to intensify the effects and release more dopamine. This is why people want to always reach that high that they once reached the first time, and because their body is building a tolerance for it, it takes a while to reach that feeling again. The pharmaceutical use. It's known as Desoxyn. I hope I'm pronouncing that correctly. It treats obesity, but more importantly, or not more importantly, equally as important, but more commonly known to treat ADHD. It helps adults who tend to be more hyperactive and that lose focus quickly to help them focus and control behavior problems. It can help them really center in on what they need to, which is pretty interesting considering that when people use the drug, the illegal version, it heightens their senses and keeps them alert and awake. The effects. It produces a quick feeling of intense euphoria. The high lasts between 6 and 12 hours, and the high varies depending on the intake and the tolerance of the individual. It can result in insomnia, and for a long period of time, 3 days is a ballpark amount, and due to the intense high, of course, this is referred to as tweaking. It interferes with dopamine production on the brain, increases the risk of a stroke, and with long-term use can damage and kill the central nervous system area of the brain that produces dopamine. Effects continued. Meth sores can form from the usage of meth on the skin, the mouth, and the gums. This is due to picking at the skin when high or burns from smoking the pipe. Yellow tooth decay is another symptom. As you can see in that picture right there, people that use methamphetamine and specifically smoke it have dental issues. It can cause anxiety, paranoia, and strokes. The risks and consequences, as we mentioned before, it's highly addictive. It increases your blood pressure, heart rate, can cause anxiety, paranoia, aggression, hallucinations, and mood disturbance after a long period of time, as well as permanent brain damage. In this study from 2019, it found that 170% of people died from a meth overdose, 59% were arrested for meth possession, and 37% past year meth SUD, and 22% used meth in the past year. That is all.